Ji, Assalamu alaikum. Uh, we are starting with the research process. This is the first video, and today we are going to talk about research question and different types of research questions. In the research process, we start with the identification of research problem and the research gap. The next step is to writing the research question. And if we have multiple questions, we can apply Finer to prioritize those questions and then apply PICO to refine the question. Then we write a hypothesis if applicable, and we have to write null and alternate. So we have a clear idea what is the null and what is our research or alternate hypothesis. Then comes the research objective, general and specific, and then writing the research variable, defining the variables on scale of measurement and according to the relationship which we are, if we are studying any relationship and we have a hypothesis, then we have to define the variables according to the relationship. Study design, the study population, and study population includes where, when, who, how the population or the subjects will be included. Ethical consideration is how to reduce the ethical issues that can arise during the study. And then comes the data collection tool. We have to identify or specify our questionnaire or the tool which we are going to use. If we are using validated tool, we have to specify that. Otherwise, if we are using a self-constructed tool, we have to validate if it's a tool and it's that variable requires a measurement. That these all points will be discussed in subsequent slides. Today our focus is on research question mainly. Then comes the data collection plan and the procedure, and then we decide how the data will be entered. We have to plan for the data coding, and then the report generation plan, what kind of analysis we are going to get out of this research. Then there is IRB approval process. For IRB approval, we submit the write-up, we make the write-up and then submit it. And then in case we have a pilot testing option available, we can have it before IRB approval or after IRB approval. And based on the analysis, we can modify our questionnaire. Then the execution of research or data collection takes place. And after the data collection, we write our thesis or the manuscript or the research report and then submit it. And there is dissemination of finding. That is the last process of the research, in which we disseminate research finding either by publishing it in a peer-reviewed scientific journal or presenting an abstract, presenting a paper in oral presentation or in poster presentation. Okay. So starting with the types of research question, we have descriptive questions. The purpose is to explore what is or what exists. For example, what are the eating habits of college students, or is anxiety prevalent among healthcare workers? So these are descriptive questions, just describing what is there. And mainly in descriptive, you can get an idea about the time, place, and person distribution of a disease. If we're talking about a disease like tuberculosis, what is the prevalence of tuberculosis, who are involved, males are more involved or females are involved. Just so we get the data in descriptive studies to answer the descriptive question, and in that data we have a description according to time, place, and person. So coming to the next question, that is comparative question. The purpose is to compare two or more groups, variables, or condition. For example, comparing male and female starting with two groups. So comparative question means that your research will be starting with two groups. Or we can have a rural urban population or a population with a specific variable or credential and the other without that. For example, we can have lung cancer patients and we can compare them with those patients with diabetes or some other disease, or patients coming without any disease. They are from the general population but they don't have the cancer. So with and without cancer, we can have two groups. Or the example could be, do patients recover faster with drug A or drug B? So there is a comparison. In the beginning we have decided to compare. Okay, so the question clearly mentioned the comparison. And is online learning as effective as in-person learning? Is again, there is a comparison between these online and in-person. The third type of question are the relationship questions or correlational questions. For example, the purpose is examine association between variables. And the example is there a relationship between sleep duration and academic performance, or does social media use correlate with depression in teenagers? So we are correlating or measuring association, or we can, in generally we can say we are talking about relationship between two variables. So in the fourth type of question, we have causal relationship, causal kind of questions in which cause and effect relationship is there. For example, the purpose is to determine if one variable directly influences the other variable. Does smoking cause lung cancer, or does exercise reduce stress levels? So if we have such kind of question, we are not talking about relationship of smoking with lung cancer. Instead, we are talking about does smoking cause lung cancer, or is responsible for lung cancer, or is influencing the development of lung cancer. So you can have these are the causative kind of relationship, cause and effect relationship. So in this case, these questions are causal questions. We have predictive type of questions. Purpose is to forecast future outcomes based on current data. Example could be, can machine learning predict heart disease risk? And does childhood obesity predict adult diabetes? Then the sixth type is exploratory questions. Purpose is to investigate new or underexplored phenomena. For example, how do AI chatbots impact student learning experiences? And what are the challenges of telemedicine in rural areas? So these are examples of questions in which we are exploring something, an unexplored phenomenon, or an unexplored area in research. Okay. We can have other types as well. Evaluative questions. The purpose is to assess the effectiveness, efficiency, or impact of interventions, policies, or programs. So whenever there is intervention in place, or a policy in place, or a program in place, in that case, we can measure the effectiveness, efficiency, or the impact, short-term or long-term impact of any such intervention. For example, how effective is the new vaccination policy in reducing disease spread? Or the other example could be, does workplace mindfulness training improve employee productivity? So these are the questions in which we are evaluating an educational initiative, a training program, or a policy, or an intervention. The other type is normative questions, in which the purpose is to examine what should be based on ethical, moral, and policy standard. For example, should genetic editing be allowed in human embryos? And what policies should governments implement to reduce carbon emissions? So these are the type of question in which uh, we are asking or getting information, and the question is about the ethical, moral, and policy standards. So we are targeting the standards in such kind of questions. We have methodological questions. The focus is on improving research techniques or tools. For example, what is the most accurate way to measure patient pain levels? So we are actually identifying the method to measure patient pain levels. We can have more than one available in the market or in the literature, and out of which one is the most accurate. So we this is a methodological question. How can survey response rates be improved in clinical study? So this is, again, we are improving our survey response methodology. And the last one is about mixed method questions. We can combine qualitative and quantitative approaches. For example, how do nurses perceive AI in healthcare? That is a qualitative. And does it improve diagnostic accuracy? It's a quantitative. So in the same question, we have a quantitative and qualitative combined approach. So how to choose a research question, a right research question? For quantitative study, our question should be measurable, a closed-ended question. For example, does X affect Y? But for qualitative studies, we need to be a more open-ended question, use more open-ended question, like how do patients perceive, or how do patients experience X? Or for experimental design, our focus is on causal question. For example, does X causes Y, or X is associated with Y? Or you can say X actually influences Y, or X predicts Y. So we can have such kind of question in experimental designs. For observational studies, use descriptive or correlational questions. In correlational question, we can have an association kind of question, if X is associated with Y or not. In cohort study, in case control study, and in comparative cross-sectional and analytical cross-sectional studies, we can have these kind of questions, association kind of questions. So here I'm going to start with the example of public health topics for practice some research questions. So for descriptive questions, they are usually used in prevalence and burden of disease studies. The purpose is to identify patterns, trends, or distribution of health issues. Example could be, what is the prevalence of type 2 diabetes among urban versus rural population in Pakistan, and does the opioid overdose mortality changed in the US from 2010 to 2025? So was there a change, or what is the prevalence? These are all descriptive type of question. They are describing what is happening, or what happened. So these, in prevalence and burden of disease study, we use such kind of questions. The design could be cross-sectional survey or surveillance data analysis. Then the etiological questions, they are used in when we are studying the causes and risk factors. If the purpose is to investigate determinants of disease or health outcomes, for example, does air pollution exposure increase the risk of childhood asthma in Mexico City or in Lahore City? In that case, we are actually investigating the determinants. We are identifying air pollution as a determinant of childhood asthma. And is food insecurity associated with higher rates of maternal malnutrition in sub-Saharan Africa? In this case, food insecurity is a risk factor, or you can say an etiological factor we are thinking about, which affects the maternal malnutrition in a specific area. The study design which can be used for such kind of question, they are cohort studies or case control studies. Then comes the intervention and evaluation kind of question. When we want to study effectiveness of a program, effectiveness of a therapy, effectiveness of a policy, effectiveness of a vaccine, efficacy of a vaccine, in that case, we are actually using intervention and evaluation questions. The purpose is to assess program policies or treatment. And example is, does a school-based hand washing program reduce diarrheal diseases in Kenyan children? Or is a sugar tax effective in lowering obesity rates in UK? So these are, sugar tax is an intervention, and the same is the school-based hand washing program is an intervention. So we want to see the impact of that intervention, or we are evaluating the effectiveness of that intervention. What is study design, which is used for such kind of question, is randomized control trials, RCTs, and quasi-experimental designs. There comes the comparative public health strategies. The purpose is to compare health system policies or intervention. For example, are mobile health clinics more cost effective than fixed clinics for vaccine delivery in remote areas? Or which smoking cessation program has higher success rates, nicotine patches or counseling? So in such kind, the study design will be systematic reviews or meta-analyses which can help us compare more effectively. Such kind of comparison of programs at this scale can be done using the systematic reviews. Then the predictive and modeling questions, or when we are actually interested to predict or make a model. Forecast outbreaks or health trends. If we are going to measure them, then we can have such kind of questions. Can machine learning predict dengue fever outbreaks in Brazil using climate data? And what will be the projected impact of aging populations on Japan's healthcare cost by 2040? So we are actually making a model, a projected model, identifying what the impact will be, what the outcome will be. Okay. So the design used is in this kind of question will be statistical modeling or AI-based simulations. Health systems and policy. The purpose is to evaluate healthcare access, equity, or policy impacts. Did Medicaid expansion under the ACA reduce racial disparities in hypertension management? And how do staffing shortages affect maternal mortality rates in South African hospital? So we are actually working on health system and policy. We are evaluating healthcare access, equity, and policy impact. In such, we can in kind of question, we the design we can use will be mixed method or policy analysis. And the qualitative question, we need to identify the perception and barriers. Explore, basically, in the qualitative research, we use the term of explore. We are exploring stakeholder experiences or cultural factors. And for example, why do pregnant women in rural Pakistan avoid antenatal care visits? And how do youth perceive mental health services in Canada? So we need to identify their perception. It will be through qualitative research. And the study design could be focus group, in-depth interviews. Then comes the implementation science, when the purpose is to identify barriers facilitated to real world adoption of interventions. For example, what challenges do community health workers face when delivering malaria bed nets in Uganda? Malaria bed nets, when they try to deliver, what kind of challenges they face, especially the community health workers. Same kind of question we can have with the polio health workers, what kind of challenges they face. So these are the implementation science questions. How can telehealth be optimized for elderly patients with limited digital literacy? And study design that can be used will be process evaluation and stakeholder analysis. These are the designs specifically for the purpose of implementation science. Then comes the question of when we in public health we're talking about ethical and equity focused. The purpose will be to address disparity or ethical dilemmas. In such case, we can have example of questions like, should COVID-19 vaccines be mandated for healthcare workers? And how does gentrification impact access to healthcare for low-income minorities in Los Angeles? So we are actually talking about equity and how we can address that equity issue and ethical issues. So in such case, the designs will be policy reviews and ethical framework. These are the public health designs used in public health research, not in other journal research, but specifically for public health. And the 10th one is the One Health that includes environmental, animal, and human links. Basically talking about that. Purpose, examine intersections of human, animal, and environmental health. That is the concept of One Health. The question could be, does deforestation in Amazon increase zoonotic disease spillover risk? Okay. So the other question could be, how do antibiotic use in livestock and human antibiotic resistance correlate? It's a very important question because we are facing antimicrobial resistance. The study design that can be used will be ecological studies and interdisciplinary research. How to frame a strong public health research question. For quantitative research use, PICO, PICOS, or PICOT can be used. PICO is population or patient, or I is for intervention, C is for comparison, O is for outcome, and if we add S is for study design. If we add T is for the time. So here PICOT is applied. Use the PICOT framework for quantitative questions. Always remember that population is, for example, urban dwellers, slum dwellers in Mumbai. Intervention could be clean water access programs. Comparison could be no intervention. You are not giving any intervention to the comparison group. Outcome could be reduction in cholera cases. Time is over 2 years. So we can have a example stated in this. Among urban slum dwellers in Mumbai, does clean water access compared to no intervention reduce cholera cases over 2 years? Frame a strong public health question while we are doing qualitative research. So for qualitative question, we use the SPICE model, SPICE acronym. How do nurses in rural Ghana perceive mobile health records compared to paper records in terms of workflow efficiency? So the setting is rural clinics in Ghana. Perspective is about from nurses. Intervention is mobile health records. Comparison is paper records. and evaluation is workflow efficiency. So we are actually exploring the perspective of nurses about the workflow efficiency between these two. Okay. An idea about why and where we apply finer. If we have 2-3 topics of research and we have made 2-3 different questions, and for example one is on tuberculosis, one is on typhoid, one is on hypertension, and I can apply finer to identify or prioritize my question, to start with which question, and which is more feasible, which is more interesting, more novel, ethical, and relevant to the community needs. So in that way we apply finer. Feasibility is not only the operational feasibility, but it involves all the resources, if time, place, person, the money, material, and the human resource, everything is, if it's available and easily manageable, then we can say the study is feasible, and there is no administrative issues, political issues associated with that question. Then if the question is interesting, more interesting as compared to other question, interesting in term for the researcher, for the supervisor, for the IRB, for the community or the readership of that, or the fraternity of that field. Or the question is novel. True novelty cannot be achieved until we are doing a basic research, lab research or animal research, in which identifying or discovering a new medicine or trying a new equipment or new technique. So novelty is not possible, is that level of novelty is not possible in pragmatic research, or you can say the public health research every time. So in that case, the gap in literature tells us about the novelty. If we are identifying the gap correctly and convincing, writing the rationale in a convincing way, specifying the gap in literature, then we can commit, we can say that we are doing a novel study, or there is a novelty. So whenever you find the research gap, then you can that question will be where the more research gap, the more novel it is. So in the ethical, if there is major ethical issue, you will give less marks to that question. With minor ethical issues, yes, that question is more feasible because it's ethically sound. There's no stigma associated with that, cultural or ethical. So relevant to community needs, relevant to the field, relevant to the requirement of the researcher. So if when I selected one question, I apply PICO on that. PICO is population intervention comparison outcome. We have just discussed. For quantitative research, we use PICO, and for qualitative research, we use SPICE. So this is the last slide showing just the again the population or universe eligibility criteria. We are going to discuss all these, what is population, what is sampling, how to in detail in subsequent video. But here you need to know what is population, anything that upon which we are going to work. For example, I am going to measure hemoglobin level, and these hemoglobin level I intend to measure on reproductive age females. So reproductive age females, they are my population or universe of study. And the eligibility criteria is the inclusion exclusion criteria upon which basis I will be including these reproductive age females into my study. For example, if I say I would like to include only married females, or I would like to include females with at least one child, so that could be my inclusion. And for exclusion, any known morbidity that can be excluded, that female can be excluded. And sample is actually part of the part of the whole, part of the universe, or part of the population which we are going to select. In the reproductive age females are my population, but if I try to identify reproductive age females, or collect my target my females attending the OPDs of a Sheikh Zayed hospital or Tertiary Care hospital in Lahore, in that case, that is my target population, and from that my target population I will be selecting my sample. And that sample will be according to my sample size. For example, I need 300 females and these 300 females will be selected based upon my selection or sampling technique. If I am going for a probability sampling technique, then I will be selecting them, giving them equal chance, or each and every member of my target population will get an equal chance of being selected in the sample. So that we will be discussing in detail soon. And the study setting is Sheikh Zayed Hospital in Lahore, or any hospital in which I am targeting. The study duration, that is also part of the population. So population includes all these 5 things. Duration will be the time period in which I'm going to approach these females. So thank you very much.